Good evening, everyone. Hey, welcome to Wellness Wednesday. I'm glad you're here. I'm going to turn down my volume, of course. I always have to do that. And want to make sure that we get everybody on that wants to get on. So I will say my disclaimer while to allow a little extra time for that. And so please realize that anything I say tonight during this Wellness Wednesday is health information and not health advice. Please don't start taking or stop taking or change the way you take any of your medications. If you feel like you need to do that, please consult first with your prescribing practitioner so that they can help you make the appropriate adjustment safely. And by attending this Wellness Wednesday, this does not establish a doctor-patient relationship. So I promised you a deep dive tonight into Hashimoto's. I mean, I know a lot of you have done so much research on this, and some of you may know a lot of this, but I thought it would be so helpful to dig really deep and really just get into what is Hashimoto's and go through some of the causes that you may not have ever heard about, and some of the symptoms. All right. So how did Hashimoto's get its name? Right. We can start with that. Hashimoto's thyroiditis. Okay, so named after Dr. Hikaru Hashimoto, who first described this in 1912. This is an autoimmune disease that damages the thyroid gland. Dr. Hashimoto, published a paper in a German medical journal in 1912 describing the disease, which he characterized, and it's called struma lymphomatosa, an enlarged thyroid gland infiltrated with lymphocytes or white blood cells, and then the destruction of follicular cells within the gland. The connection to autoimmune disease began to be recognized in about the 1950s, different from other forms of thyroiditis. Ongoing research is finding the potential connection with other autoimmune conditions as well, and it's now recognized as the most common cause of hypothyroidism in many countries. Now, rather than a mistaken immune system attack on the thyroid, as much as conventional medical wisdom asserts, right? Autoimmunity is actually a protective mechanism, and I'll talk more about this later, so keep that in mind. Hashimoto's can progress slowly to cause hypothyroidism, or it can cause a transient hyperthyroidism early on and is often misdiagnosed as Graves. Just yesterday, spoke with a potential patient who indeed was misdiagnosed this way with Graves, and upon checking her labs, she actually has Hashimoto's. So diagnosis requires the presence of one of two or both antibodies in the blood. These are called TPO, or thyroid peroxidase antibodies, and thyroglobulin, or TG antibodies. It's the presence of one or two of these two antibodies, or both, that is required to diagnose Hashimoto's. It's interesting. The Cleveland Clinic asserts, and I have this written up so that I can say it right, with lifelong monitoring and treatment, the prognosis or outlook for people with Hashimoto's is excellent. Interesting. Contrast that with their very next statement. If you have hypothyroidism from Hashimoto's disease that's untreated, it can lead to certain health problems. I find this kind of amusing, okay, when they say this. I'm going to talk about these health problems: high cholesterol, heart disease, or even heart failure, high blood pressure, depression, myxedema coma. This is a rare complication of severe hypothyroidism where, your body's functions slow down so much that it can be deadly. What about potential problems with pregnancy, an increased risk of miscarriage, premature birth, stillbirth, even preeclampsia? This can affect fetal growth and fetal brain development. Okay. The Cleveland Clinic also says that the good news is that Hashimoto's disease is manageable and a treatable condition. If you're experiencing symptoms of Hashimoto's or have certain risk factors, then like family history of thyroid disease, be sure to contact your healthcare provider. They can run some simple tests, right, to see if your thyroid isn't making enough thyroid hormone. Now, how many of you agree with that? In fact, how many of you have been tested for Hashimoto's? If it's the number one cause, do they even check you for it? Has your hypothyroidism been managed well, monitored well? Has the testing really been simple? Right? How many of you still have symptoms? Right? I frequently say Hashimoto's is the center of the storm, right? Why? Because it causes hypothyroidism, and this can affect the whole body. All right. So again, I just find it amusing that they say it can be, that the prognosis is excellent and it's, it can be easily, simply managed. I mean, why do we have 36,000 women in this group if it were actually that easily managed? All right. So simple. Sorry for my sarcasm, but yeah, it's just, I don't know. It boggles my mind. So here are some of the symptoms of Hashimoto's. And I've listed them here so that so that I can read them off and not forget any. But certainly we're familiar with so many like depression or anxiety, like heat or cold intolerance, hair loss or hair thinning, infertility. Okay, so irregular or heavy periods. We have fatigue, disturbed sleep, puffy face, weight gain or weight loss, certainly, memory problems, depression, trouble concentrating, all that, right? Increased resistance in blood vessels, so high blood pressure, decreased heat production and decreased fat breakdown, poor gallbladder function or gallstones, slow heart rate, decreased heart pumping ability, fluid around the heart, reduced blood flow. These are all symptoms of this disease. Certainly constipation and sluggish digestion, which many of you experience. Interestingly, decreased glomerular filtration rate, so kidneys, right? Reduced water excretion. Decreased liver function, certainly, increased total cholesterol, LDL, and lipoprotein A, which some of you may have genetics for higher rates, higher levels of these. I found this interesting, slow breathing, low oxygen levels, right? Fluid buildup around the lungs, decreased muscle strength and reflexes. That's pretty common with hypothyroidism. Muscle or joint pain too, and cramps, muscle cramps. And then, of course, skin issues, dry, cold, even yellowish, thickened skin, right? These are all symptoms of Hashimoto's causing, which is causing hypothyroidism, causing these symptoms, right? So local symptoms or effects on the thyroid gland itself and the neck area can literally, this can literally cause shriveling of the thyroid. I probably give this example a lot, but several months ago, I was talking with a potential patient, and she related to me that she had just been in for a repeat thyroid ultrasound after 10 years, and the radiology technician doing the scan asked her where her thyroid was. And she said, "What do you mean?" And he said, "Well, where's your thyroid? When did you have it removed?" And she said, I hadn't had it removed. So essentially her thyroid was all shriveled up. Had another patient as well tell me that with her repeat ultrasound, it was 2/3 smaller than the prior study. But this can also cause thyroid enlargement too, right? So goiter symptoms. So an enlarged neck, you'll see a disappearance of the neck lines, right? Enlarged lymph nodes can occur, neck pain or swelling, throat discomfort, so sore throat, vocal changes even, difficulty swallowing, and difficult or labored breathing too. All right, so some of the causes of Hashimoto's it's conventionally thought that that it's a breakdown in the immune system's normal tolerance to the body's own tissues, right? Whereby the immune system mistakenly attacks the body. And then this error leads to an attack on the thyroid gland. Okay, so if this is true, the mistaken attack will be caused by something, as is always the case, right? And rather than a misguided attack, the immune system follows specific rules like everything else in the body. Okay, so there is a vague understanding that there are epigenetic changes, such as DNA methylation, that might increase the risk for Hashimoto's. I should say problems with methylation, right? And half of us have the gene mutation where we don't methylate folic acid, which is needed to methylate DNA. Our food is depleted of the nutrients we need as well, right? So we're not getting these methylators, if you will, and then we're having trouble methylating the DNA to help it work properly. But there are so if you think about if this is a mistaken attack, is it really mistaken, or is it because there are signals, inappropriate signals, that the immune system receives? Is it really the immune system that has decreased its tolerance for, our human tissue, right? Is that really what this means? This decrease or breakdown in the immune system's normal tolerance to the body's own tissues? Or are there just signals that it's receiving, that the immune system's receiving? Okay. Food for thought there. And so that's why I always say that, in fact, this is a protective mechanism, because when the immune system sees something wrong, it's never going to unsee it. It's always going to be looking for that. It's programmed into what it sees, just like what happens with us, our brains. We don't unsee things that we look at. Some things certainly stick, but we don't necessarily unsee it. And then when we see it again, we're reminded of it because we've seen it, right? So that's what happens with the immune system. And so it sees something wrong with the thyroid gland, and then it goes and protects us, right? Protects us from that something wrong, and it causes collateral damage, damages the cell that has that problem that it sees. Okay. So think about this as I talk about these other causes and why these other things cause problems with the thyroid, and then increase the risk and the really start the autoimmune process ball rolling. Okay. So there are other causes like bacterial and viral infections. Epstein-Barr virus is a huge one. We've seen that in the literature. Hepatitis C, right, is another virus that will tend to affect the thyroid. So Lyme, from the Borrelia burgdorferi toxin, okay? H. pylori, many of you have heard of this, in the stomach, can lead to developing Hashimoto's. Yersinia pestis, oh, it's a nasty name, this bacteria that causes the plague, right? We just had a patient diagnosed with this on the stool test, right? diagnosed with Yersinia, and they have Hashimoto's, oddly enough. Okay, interesting. And certainly SARS-CoV-2, right, can cause problems with the thyroid. And then we have gut bacteria overgrowth or dysbiosis can lead to autoimmune development, especially reductions in bifidobacterium and lactobacillus. So some of you have done your research, know that those are important bacteria in our systems. And when we see a reduction, this is shown to increase the likelihood of developing Hashimoto's thyroiditis. So how does inflammation, let's not forget about stress. This affects multiple systems, right? This certainly interferes with thyroid function. Stress causes cortisol release, right? Cortisol interferes with TSH production. It interferes with thyroid hormone production in the thyroid. It interferes with the liver's ability to convert T4 to T3, right? So this stress by other mechanisms too could also cause the immune system to see something amiss, right? One second. And sorry, I should have turned that sound off. Okay, so these stress changes, right, can induce inflammation. And this then promotes autoimmunity in the genetically predisposed person. What predisposes people to Hashimoto's? Well, some of you that have had, that are patients that have had the HLA testing, genes that cause immune susceptibility, biotoxin susceptibilities, are some of those genes literally say you have a predisposition or identify a predisposition for developing Hashimoto's, okay? So these often predispose individuals to this autoimmune disease. And then inflammation. How does inflammation cause Hashimoto's? Well, when free radicals outnumber the antioxidants in your body, this will lead to damage to the thyroid cells, which also then looks like something's going on to the immune system, and the immune system will come along and start attacking the thyroid. So there's that mechanism. Toxins like pesticides made with halogens like bromine and chlorine, heavy metals like mercury, and things like nitrates, right? These can elicit, potentially trigger Hashimoto's thyroiditis. Polychlorinated biphenyls, or PCBs, and flame retardants are among some of the chemicals out there that can disrupt thyroid function and immune regulation, also potentially triggering Hashimoto's thyroiditis. You've heard of this one, bisphenol A, or BPA, right? In plastics. This has been linked to thyroid autoimmunity, lower thyroid hormones as well. It's also been shown to promote higher thyroid antibody levels, as well as disruptions to thyroid hormone receptors. Dietary imbalances like excessive iodine, deficiencies in iron, right? Selenium, deficiencies in selenium, deficiencies in vitamin D are all associated with Hashimoto's thyroiditis. Okay. Too much post-childbirth progesterone may also contribute to Hashimoto's. Certainly long-term or repeated radiation exposure and certain medications also increase the risk of developing Hashimoto's. These include certain cancer drugs, treatments for bipolar disease, heart medications, MS treatments, things like this. Okay. So I have covered the definition and what the diagnosis requires. All right. I've covered a lot of the symptoms that you can have, and I've talked about multiple causes, which traditional medicine doesn't really ever look at because they don't even look for Hashimoto's. Why? Because there's no medical treatment for this. There's no medical treatment for Hashimoto's thyroiditis other than let's ablate the thyroid, right? I mean, there's no pill for it. Let's take the thyroid out. Let's go right to that, right? And this, unfortunately, this misunderstanding, this blunted understanding of what Hashimoto's is and what causes it leads to just it's just got to be dealt with. The thyroid's got to come out, got to be, if they even look for it. And for many of you, they haven't even looked for it because there really is no real answer to treat Hashimoto's thyroiditis. Remember that this is not a thyroid problem. It's an immune system problem. Finding these triggers that fuel the fire, the autoimmune fire, is the key to successful management. This is not simple, and Hashimoto's certainly does not have an excellent prognosis if it's never actually addressed, right? It must be treated with a comprehensive and customized care plan after receiving a careful and thorough comprehensive diagnosis of the triggers and imbalances. You've also got to find the deficiencies. You also have to find the complicating factors. It's just not as simple as these large medical centers assert by any means. The good news is, when this approach is taken and my blueprint is followed, we see amazing success and some awesome transformations. So I often look at it like this. If you don't balance the immune system properly, if you don't discover all of the triggers for this Hashimoto's, then you're never going to properly address the immune system problem that this is. You can continue to receive, get the treatment for the hypothyroidism, right? They can continue to give you this thyroid replacement. I was going to say the hormone replacement therapy, but it's thyroid replacement hormone that they'll replace because you're in a hypothyroid state caused by the Hashimoto's, but they feel like they fixed the problem just by giving you the thyroid medications when they see a high TSH. And I do go into this in great detail, looking at all the markers, the appropriate markers to get an appropriate comprehensive diagnosis during the master classes that I give periodically. And yet they can give drugs to palliate the immune system too. They can give you drugs for every one of these symptoms almost that we talked about, at least many of them. And yet you're never going to get anywhere because they're not addressing the actual triggers. They're not addressing what's fueling the fire. So this is where I believe traditional medicine has gone wrong with this. They're not looking for the causes, and they're not addressing the real problem, which is that this is not a thyroid problem. This is an immune system problem. And you take this approach for any other autoimmune problem because these are autoimmune diseases. So things like lupus, things like Sjogren's, psoriasis, rheumatoid arthritis, ankylosing spondylitis, all of these autoimmune problems, if we just address the immune system, then we're going to do much better. We're going to see much better results. So I always spotlight, patients in the master classes that I give, and we're sure to post patient success stories in this group because I want you to see what's possible. The majority of these patient successes are overcoming this Hashimoto's. 95% of our patients have this Hashimoto's as the cause of their hypothyroidism. And many of them have complicating factors, major triggers, including blood sugar issues and insulin resistance. This is one of the major triggers for the autoimmune process, major things that fuel that fire. And so why are they getting better? Why are they having such success? It's because we're treating the problem. We're not ignoring the immune system issue, right? And so we're dealing with the triggers all at once. And then we're providing the nutrition, making sure that the inflammation comes down. We're getting the toxins out through a very individualized detox process, right? And that's helping these wonderful patients get these awesome results, have these amazing transformations. So that's Hashimoto's in a deep dive. And it's not a thyroid problem. So the treatment is customized care, customized treatment plans that address all of the root causes and triggers. It's not that easy to just spell out for me to say, here, go take this supplement and that supplement and go, make these dietary changes. I was just talking with a potential patient today. Why can't I give, dietary advice that applies to everybody? Well, because different foods are triggers for some people. Different foods trigger autoimmunity too. And remember the pesticides and the toxins that can come from our food. Remember the triggers that I've talked about, the blood sugar issues. And again, I go into much greater detail on all of these during the master classes. And I just want you to remember, I want you to have hope. I want you to remember that there absolutely are answers. All right. And if you're feeling stuck because your doctor's not getting the right tests or not looking for these causes, that's why you're here. And my goal is to give you the right information that will help you realize what needs to happen in your care. All right. So that's Hashimoto's, right? In a nutshell. And thanks for attending tonight, for attending Wellness Wednesday. And remember, ladies, you still have the power to heal. Have a great evening, and we'll see you soon.